Thank you, those participating in this session. Good morning, good afternoon, good evening. Welcome to the 1612th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for a minute. Thank you and welcome back. Today we have with us Dr. IQBAL ANSARI, BHMS. IQBAL ANSARI, Homeopathy Clinic, Skin, Joint, Child and Women Care. S3 Swagat, Unique Tower, opposite Lakshmi Park, Lotha. Practicing classical homeopathy since 2007. And the topic is importance of concomitant symptoms in homeopathy. So on behalf of IFPH, I welcome Dr. IQBAL Ansari. You can have a platform for the next 45 minutes. Please proceed. We just joined Dr. IQBAL Ansari. You are always maintaining time, please.
Yeah, hi, sir.
Yes,
Am I
please.
audible?
Yes, audible, please. Yeah.
Yeah, good evening, everybody. Good evening.
Yes.
Just a sec. Sorry for being late. I'm sharing my screen.
Okay, you can share.
Yes, sir. So, my dear friends, today's topic is on importance of concomitant symptom in homeopathy. Myself, my name is Dr. IQBAL Ansari, practicing in a small town of Mumbai. I am deeply honored to speak today on the topic of importance of concomitant symptom in homeopathy. Just a second. Imagine you are putting together a puzzle, like the main complaint, the patient's illness is like the biggest piece of puzzle, but without the smaller pieces, the picture is incomplete. The smaller pieces that are what we call concomitant symptoms. This is important. They seem unrelated, but are critical to completing the overall picture of the patient. My voice is clear, right? Hello?
Yes, no problem. Very clear.
Okay. Today we'll explore how these symptoms guide us to select the most effective remedy in homeopathy. We'll also dive into real life cases, connection, and how homeopathy pioneers have used these principles to transform lives. By the end of this session, you will understand what actually concomitant symptoms are and how to identify them, why they are crucial in prescribing the right remedy, how concomitant symptoms related to miasms, the deep-rooted tendencies behind diseases, case studies that show their real-life applications. So let's embark on this fascinating journey. Let's define what concomitant symptoms is. In a simple language, concomitant symptoms are additionally peculiar symptoms that occur alongside the main illness but don't directly connect to it. They act as the body's subtle signals guiding us towards understanding the person's unique condition. For example, let's make it easy to understand. A person with stomach pain might also have unusually cold hands. Cold hands are not related with stomach pain. A child with fever might feel better only when carried or rocked. These symptoms are like breadcrumbs that lead us to the correct remedy, which is very unique to the patient. Imagine visiting a doctor for a headache. If two patients report the same complaint, but one says the headache gets worse in the sun and the other says it gets worse in the evening, does that make a difference? Actually, in homeopathy, we individualize the case patient, right? So concomitant symptoms does that only. Absolutely, these details allow us to individualize treatment, a fundamental principle in homeopathy. Am I fast?
No problem.
Okay. Here's how you know a symptom qualifies as a concomitant. There are three rules. It appears at the same time as the main complaint. It doesn't directly explain or cause the main problem. it seems unusual or peculiar. So example of concomitant symptoms are like main symptoms. Suppose it's severe cough and patient is also having sweating on the forehead during the cough. Second example is main symptom is stomach pain, and concomitant symptoms is like desire for cold drink even though the person feel cold. These are the symptoms that complete the case and help us find the perfect remedy for a patient. What did Dr. Samuel Hahnemann sir say? Dr. Samuel Hahnemann, the founder of homeopathy, stressed the importance of uncommon, peculiar symptoms. In his book, The Organ of Medicine, he said, most striking, singular, uncommon, and peculiar sign and symptom are chiefly to be kept in view. This is important for us, right? In every case. In other words, while common symptoms may describe the disease, it's the unusual symptom that help us find the remedy. So for this only we are looking in each cases. So let's see what Bonninghausen's contribution is there. Dr. Bonninghausen, a key figure in homeopathy, took Hahnemann's idea a step further. He developed a framework for evaluating concomitant symptoms, emphasizing that often hold the key to the successful treatment. For example, he would note a patient with a fever feels extremely thirsty. A patient with joint pain has a burning sensation in the stomach. Here, in the fever and thirst is not just related to each other, but patient exhibit a kind of symptom. And same with the joint pain, burning sensation in the stomach is not related to the joint pain. What H.A. Roberts said, what concomitant to the totality is modality or single symptom. Its simple mean the differentiating factor of totality is concomitant symptom, and that of a single symptom is modality. Like the totality of the symptom is having a concomitant symptom we differentiate it completely. Concept of totality of symptom of Dr. Hahnemann and Dr. Bonninghausen. In aphorism number 6 and 25 of Organ of Medicine, we can see that Hahnemann is talking about the number of symptoms or numerical totality, and if directly in aphorism 153, the practical part of Dr. Hahnemann deal with characteristic totality. In the footnote of to aphorism 153, Hahnemann praised Bonninghausen for his meritorious work on setting criteria for characteristic symptom, and hence it can be amply relied. Bonninghausen retrieves that the concomitant symptoms are just coexisting symptoms of a disease under consideration but distinguished by a rare peculiarity and can be elevated to the rank of a characteristic symptom. So there are three standards what Bonninghausen sir has put. So first one is rarely appear in connection with the leading disease and are therefore also found rarely among the provings. In a case of fever, the patient prefer to drink only in the stage of chilliness. It, in a rare case, rare peculiarity, and appears come in the scene. The other being symmetrical distribution of eruption of arnica, prosophagia, associated with nasal discharge of same side of spigalia, diarrhea without prostration of acid force. Second standard, what Bonninghausen state is like those which belong to another sphere of the disease than the chief ailment. The criteria was usually highlighted by many and elaborated with the prefix that there should be no pathological relation to the chief ailment. The common examples are headache ameliorated by profuse urination, that comes under gelsemia, coryza associated with polyuria that comes under calcarea cough, pain with chilliness, it comes under pulsatilla, prolapse, and uterine affection, which is ameliorated by crossing leg, but with ample empty organ sense sinking feeling in the abdomen and less sexual desire that come under sapia. And the third criteria that Bonninghausen has put is those which have more or less of a characteristic sign of one of the medicine, even in case they have not been before. Notice in the present juxtaposition, the fact of putting things that are not similar next to each other. In a case of erysipelas with vesicle, the patient complained of the characteristic burning during maturation. Tenesmus and the bloody urine points toward cantharis. Or in a case of cantharis, prolapse with a desire to give hard pressure on the parts and increase sexual desire will make one think of it. Think of Lilium tick. Other instances satisfying the above qualification through urinary symptoms and increased sexual desire are not the usual accompaniment of the former and the later disease respectively. So concomitant symptoms come under the art of case taking also. It's the main part of it. Finding concomitant symptoms require careful observation, detailed case taking. A practitioner, we must ask, what else do you feel when this happens? Is there anything unusual or different about your condition? Patients often think these details are irrelevant, but they are not. In fact, they are the most important clues we have. Remedies with concomitant symptoms. I have noted down 50 homeopathic medicine with key symptoms, concomitant symptoms. First is aconitum napellus, intense anxiety with cold sweat during fever. Arsenicum album, where there is especially burning pain relieved by heat with great restlessness. Bryony alba, where constipation with dry mouth and great thirst for large quantities of water. Dry cough with intense thirst for large amount of water. Calcarea cough, cold, clammy feet, along with easy fatigue. Pulsatilla, desire for fresh air and no thirst during fever. Complain worse in the warm room, but better outdoors. Nux vomica, irritability with ineffectual urge to pass stool. Here in Nux vomica, mental complaints related with the rectal complaint, stool. Sapia, apathy with indifference to menses. Sulfur, heat on sole of feet at night, needing to uncover them. Belladonna, hot red face with throbbing headache. Sudden intense symptom with redness and heat. Digestive issues with irritability. All come under belladonna. There are many symptoms in each and every remedy, but we have to look after it. The most striking which I got, I have noted over here. Chamomilla, unbearable pain with extreme irritability. Lacacious, hot flushes with intolerance to tight clothing around the neck. Phosphorus, anxiety with burning in stomach relieved by cold rain. Lycopodium, weakness after eating with bloating, especially in the evening. Natrum muraticum, craving for salt with weeping while alone. Rust toxicodendron, stiffness relieved by motion and worse during rest. Cilicia, offensive foot sweat with splinter-like sensation. Kalium carbonicum, traffic with weakness in the knees. Hypersulfurous, hypersensitivity to touch with extreme irritability. Dulcemium, drowsiness with heaviness of eyelid during fever. Ignatia amara, lump in the throat sensation with grief. Apis mellifica, swelling with burning and stinging pain relieved by cold. Carbo vegetabilis, extreme weakness with coldness of extremities. Merc solubilis, profuse salivation with a metallic taste in the mouth. Causticum, paralysis with retention of urine. Strepsisagria, urinary discomfort with surgical procedure, after surgical procedure. Skin complaint alternate with joint complaints. Antimonium tart, cough with rattling mucus but no expectoration. Kalium bichromica, thick stringy nasal discharge with sinus pain. Sinus pain. Stomach complaint alternates pain in extremities. Aurum metallicum, depression with a strong desire for death. China officinalis, weakness after loss of fluid. Argentum nitricum, anticipatory anxiety with diarrhea. Thuja occidentalis, warts with a sensation of something alive in the abdomen. Spongia tosta, dry barking cough relieved by warm drink. Hypericum, shooting pain after nerve injuries. China officinalis, weakness after loss of weight. Colosynthesis, abdominal pain relieved by bending forward. Veratum album, profuse cold sweat with violent vomiting and diarrhea. Cantharis, burning Simicifoga racemosa, muscular soreness with nervous restlessness. Euphrasia, profuse eye discharge with bland nasal discharge. Podophyllum, painless discharge with gurgling in the abdomen. Platina, numbness and coldness with haughty behavior. Hyoscyamus, jealousy with convulsion or spasms. Cocculus indicus, nausea worsened by motion. Stramonium, fear of darkness with violent behavior. Camphora, collapse state with extreme coldness of the body. Conium maculatum, vertigo on turning the head sideways. Allium cepa, acrid nasal discharge with bland eye discharge. Ruta gravulans, eye strain with a bruised sensation. Ipecacuana, persistent nausea with clean tongue. Bryanea alba, headache worsened by motion and better by pressure. Parum phosphoricum, first stage of inflammation with pallor and weakness. Concomitant symptoms are like hidden treasure. They might seem small, but they have a big impact. They guide us toward a remedy that matches the person as a whole. When we pay attention to these details, we treat not the disease but the person as a whole. Thank you.
Okay, did you finish?
Yes, sir.
Yes. So time for discussion. A lot of experienced persons in this platform. So please raise your hand. You can add something. Definitely some additions and modifications is needed.
Actually, I was in misconception that it might take a bit long for my presentation, but it just
Yes.
took 10 to 10 minutes. I'm
Yes,
sorry.
yes. So we should be able to mix more points rather than you mentioned the slides. Definitely, if from a teacher or material medical, he can add something. That's the limitation of us because the
Yes.
material was subject. Anyway, we are nicely present, but I think that these concomitants are not the usual accompaniment of a disease. That's the most important thing. But they are not the characteristic features. That's the difference, I think. When you mentioned the coryza polyuria, it's a concomitant symptom. A lot of these symptoms you mentioned are actually concomitant, but I think some of the symptoms, I think it is character symptoms. Dr. Indranil, what is your opinion?
Right.
Yes, yes, sir. Yeah, thanks for giving me the chance to talk. Actually, sir, the slides which you mentioned were okay, but they are like sir mentioned during drug proving. These are the characteristic symptoms observed with the chief one complaint. They sound like that. Actually, books have taught us concomitant symptom is related to the chief complaint, but not at all any relation with the chief complaint. That is there.
Not pathological related. That is, I think, isn't it? Am I right?
Yeah.
Yes.
Actually, sir, some two questions, if you allow me, can I ask Dr. Ansari?
Yes, sure. You can ask. No
Okay,
problem.
sir,
Yes,
many a times what happens, I'll tell you, in private practice, many a times we get see that the concomitants are missing in the repertory. We don't get anywhere, but you get in the case. So
yes.
how should we approach? That is the main thing. Means I'll tell you example of today. I had a female having like scrapping sensation in the throat and having cough for 2 months. And she said, sir, I'm also having coldness of legs and my nose only. I could not get the symptom of coldness of nose as a concomitant with cough. This happens many times. So how should we approach such cases? And after
Through
that, yeah.
in repertory we can get, right? When we repertorize and some like the symptom which are mostly given in materia medica also are not completely in the repertory, and some symptoms which are in the repertory are not completely in the materia medica, right?
I think it is there in the Boger Bonison report. I think. Am I right?
BBCR is one of the good repertories. Actually,
Yes, that is the best. I refer mostly that only.
many symptoms are given there. And secondly, sir, in advanced pathological cases, when we see them, they all lack in the location, sensation, modality, and concomitants.
Yes,
So
right.
what should we do about the concomitants in advanced pathological cases? How should we pursue them? Can you tell us?
In advanced pathological cases, like it's a
Renal.
very minor, like thread. It is a minor line in between every case. So that we have to search in each and every case. Like suppose recently I got a case of autism, right? And that child was having like pain in neck, okay, with coryza. This symptom is nowhere given. I didn't find. Okay, but on complete totality, I got a carcinosin indicated, and I gave, and he got result with it.
That is a portrait of disease, you
Yeah,
mean?
portrait of disease. Yeah,
Portrait of
like
disease, you
yeah,
mean?
yeah.
Yeah. Sir, I mean to say we get renal failure cases in our homeopathic practice. We get advanced fourth stage cancer cases, and many times concomitants are not observed. So, like, how to pursue them? And if they are there with a very mild intensity. So,
Yeah,
how should we
it's
pursue
very
them?
mild. So, like patient is unaware with the associated symptoms. Patient को ऐसा लगता है कि like these symptoms are very least grade. I'm not caring about it. And what we homeopaths do, we also neglect sometimes. Like suppose a patient came with a headache and he is not concerned about his acidity, or he's farting. He's not like passing flatters or irritation. He is not concerned about it. But this is the biggest mistake we
Yeah, you
we
have to
do
say.
in the cases, right? Suppose
Yeah.
patient is having some kind of boil, tiny eruption, or like a mole on his body, and his complaint, both are associated, and we miss over that. It's
Okay.
our mistake and sometimes patient mistakes also.
Okay. Secondly, autism case you sir mentioned. Should we take mentals as concomitants in any case?
Yeah, yeah. Mental. I have mentioned over here in my slide like some symptoms are mental and physical also.
No,
You
but
can
can a concomitant symptom be a mental symptom?
Yeah, obviously it can be.
Achha. So that also we have to pursue.
Yeah.
Okay. Thanks for your good
In-
explanation.
In aphorism number 153, Hahnemann sir have explained everything in 2 lines: peculiar, striking symptom, uncommon symptoms. In the case,
Okay. Thanks for your good explanation and for the time given. Yeah.
yeah, thank you, sir.
So you just mentioned 150 is the most difficult task. Should know about what is peculiar, what is not peculiar, what is common, what is uncommon. So comprehensive knowledge on medicine is needed there. That is the only option there. I think Hariharan sir is the most apt person to comment on this. Hariharan sir, are you there? Hariharan sir.
Okay,
Yes, sir,
okay,
please.
okay,
Yes.
Dr. Manoj, I am here. And I completely watched Dr. Iqbal's class. That is very limited, but it is very informative.
I'm
See.
extremely sorry for that, sir.
Okay, that is normal.
Because
That is
initially I
Yeah.
made a slide of 20, but later on I added some more things and it went to 34, 35.
Okay, doctor, that is good because see, in my opinion,
Yeah,
actually the medicines are not the medicines, but it is a person.
yeah, right.
You said, see, certain personality traits is there. See, suppose you said urgent nitrogen. We can't deny the urgent nitrogen without the anticipatory anxiety. See, anticipatory anxiety is the prime character of the urgent nitrogen. You said that. That is very good. See, another thing.
Thank you.
Another, if we say another medicine, lactasis. See, suspicious, loquacious, and jealousy. That is the importance of lactasis. See, without these characteristics, we cannot prescribe this lactasis. See, likewise, lycopodium. The important mental symptom of lycopodium is cowardness. That is very important. And other things are there, but I am saying only one or two characters of this lycopodium. See, another is natrum. We can see suppressed grief and crying alone. That is the importance of natrum. So, if we prescribe for such a character, natrum will give much result. See, likewise, that is pulsatilla, intermittent laughing and crying. A person is laughing and another next moment she is laughing. That is pulsatilla. There is no, that is the peculiarity of pulsatilla. All the medicines have like this, no? See, acid fluor, if I say acid fluor, see, main thing is that he is not spiritual. Acid fluor. And not sensitive. Acid fluor. That is the main character of acid fluor. And likewise, another medicine, these are all the medicines you have. See, Naxomica, ambitiousness, and craving for spicy things. and along with alcohol and wonderful ambition, that is Naxomica. This is the main characteristics of that Naxomica. These are all persons we can see in our society. We can see such, we will meet such persons. You know, see, Tuja. Tuja is a very, I mean, his we do not find out his intention. His intention we do not find out. But we can find out the intention of Medornum. We cannot find out the intention of Tuja. That is the character of Tuja. So it is a psychotic medicine, and Medornum is also a psychotic medicine. See, likewise, we can differentiate most of all medicines. See, Tuja is untruthful. No, he is not truthful. Tuja is not truthful. He's a manipulating man. Manipulating. That is Tuja. Suddenly we will get them in our mind that that person is psychotic and he may be a Tuja patient. See, next is Platina, you know. See, Platina. Platina, we know that. That is, Platina is having perversion of sex. That is Platina. And even though she is idealistic, perversion of sex is there. And she tried to attract others by showing her appearance. That is Platina. Other symptoms, other characters are there, but I am saying only we can find out certain persons by talking that person or seeing that person, and we can understand his character through our materia medica. See, sulfur, by seeing itself, we can understand that may be a sulfur patient. That appearance of ugliness. He disliked bathing. And while he comes to our dispensary, sir, that ugly smell, suddenly we will think about Tuja. All other medicines are there, all other characters are there, but I am in one word, I can say like this. See, okay, time is too much, a lot of other medicines. See, phosphorus, by seeing that person itself, we can understand that is phosphorus, because such a loving nature. By showing that loving nature, he will come to us and talk with us in lovingly. See, I think Cilicia is also like that. Usually, I will say that a man who marries Cilicia, that is complement each other. Usually, I will say like that. Okay. Next is, okay, Heparsal. We can see Heparsal is highly chilly. He can't tolerate AC. Suddenly he will say, I do not want AC, please close it. Such a Heparsal is such a chilly patient. Okay, thank you very much. The other a lot of persons are here to talk. Let them also talk about it.
Yes.
If time, I will talk. See, if I got
Yes,
time.
sir, definitely you have opportunities, sir, because there's a plenty of time and Majority of persons will not respond like you because there is a phosphorus element in you. That is the reason you are always responding with love and care. That is, I think, that is my conclusion. I think. Then you mentioned about this tuja. I think with all customers, there is a tendency to deceive. Always a tendency to deceive. Then Ken describes about the sulfur. Cleanliness is not an idea to sulfur patients. It's one word. One sentence is well enough to understand what it is. That is the Dr. Harian sir has just mentioned. Then HEPAR self is a hypersensitiveness is there. Always, mentally, physically, it's always hypersensitive. That's HEPAR self. If anybody would like to participate, please raise your hand. I think Ram Parvesh sir also is definitely capable of giving more clues, more information regarding medicines for the last 30 years of practice. Yes, sir, please.
Thank you, Dr. Manojji. And congratulations, Dr. IQBAL Ansari, sir. Very nice
Thank you.
presentation, and peculiar symptom. Symptom is a very important symptom in the homeopathic science. Daily use symptom. Vrania, large quantity of water, thrust. So very important symptom. Concomitant symptom is a very important symptom. Select remedy. So very thanks, Dr. IQBAL Ansari ji. Thank you.
Yes, I think the concomitants must be differentiated from characteristics. Of course, the 153 says about characteristics, but here what happens is that pathology, it is not pathologically related. That's the most important thing. I think Boniasen is a person who is always promoting and is very fond of this concomitant symptoms, and always which help us to differentiate one medicine from another one. Then only it becomes a remedy. So whenever we are talking about this term, drug, medicine, and remedy, we should have a different idea what it is. So it is drug is differently from medicine. Then this medicine is different from remedy. So after a proper judgment, then only we will get a remedy. We will reach a remedy. Then again we can declare it was a remedy only after curing the case. Otherwise, we can say, I prescribe a remedy and I am waiting for that result. That is not right. I give a medicine and I am waiting for that. So whenever you can say remedy, only after complete the cure or the process. What is your opinion, Dr. IQBAL? Please unmute, Dr. IQBAL. Please unmute. Yeah.
Yes, sir. Yes.
Okay. Now there is a comment, Dr. Indranil. What is your comment? Could you please unmute, Dr. Indranil?
Yeah. Sir,
Yes,
thank
please.
you. Yeah, thank you for allowing me. Yeah. Actually, two stalwarts have given us this thing, that value of concomitant symptoms. They have given very nice. Actually, according to Hahnemann, he said there should be common symptom, general symptom. It can be uncommon or any peculiar. So even common symptom can be also concomitant. Like common symptom of cough we see in hay fever. We see very common symptoms of hay fever also. In case of piles also we see many common symptoms, rectal burning and pain. And Boning Usena has only said as primary, typical or secondary sensation with LSMC. So both have differentiated very nice. In our mind, concomitant means existing only with the chief complaint, but it is not so. It can be a general symptom,
Right.
or it can be any common disease symptom also.
It
Only
can
that
be any modality. It can be modality, sensation, location, anything it can be.
anything, any common we exist along with the main symptom like they have given.
That's why I said it's like a hairline.
It's
that
like a
we have to.
Yeah, and many times a single concomitant can solve a very complex case. Was said by Dr. Hahnemann that if you get a concomitant, you are lucky.
Yeah.
A concomitant in a repertory or materia medica, it solves everything. The entire case is solved because single concomitant. So it's very important. Correct.
What I have seen, like it's the main when we go do our analysis. It's the best key to differentiate remedy, like
Yeah.
to get the exact spelling.
Exactly. Two examples I'll just give you. Ischulus we use for piles, but ischulus has a concomitant of backache. So if you get two patients, both are cured. We have seen fistula in ANO alternates with chest complaints. We have seen in calcarea foss. So if these two, we get a simple concomitant, entire case is solved.
Right.
That is the main thing. Actually, fistula is a surgical case, but it can be managed with homeopathy.
You're right.
because of the concomitant.
Right.
Correct, correct. Thank you, sir. Thank you.
So there makes a difference. You can see often Hahnemann describes it's a case of disease. Now, what is the difference between disease and case of disease? Because if it is always representing the or manifesting the individual symptoms, then it becomes a case of disease. Otherwise, it will be only a disease. Let's mention the staphysagria, some wet sensation, or sulfur, the sepia, ball sensation. Well, these are always converting the cases into case of disease into case of disease. There's a difference. If anybody would like to participate, we must always participate this discussion, so that will enhance your knowledge as well as you can contribute. Definitely, almost all persons has got their own experience of reading, practicing, and hearing. So it's always better. Always it should be our policy to discuss with each and everyone. So then only it will be improve as time progresses. If anybody is there to practice, Hariharan sir, do you have anything more? Enough time, sir, please. Hariharan sir, are you there?
The concomitants are very, very important.
Sir, I think it is better to open your camera, sir, so that Dr. Iqbal can see you.
I have not.
If any problem, then you don't. but
I
if
think
you
I
can-
think I am the most junior over here. I think so.
No, 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 no.
It's my luck to learn from you people.
See, for knowledge, there is no age barrier. You have the knowledge, then sometimes that may, maybe than us. That is a truth. See, age is not a problem. But in the experience, sometimes we have more, we have more. See, in concomitant is very, very important. See, in my last, 1 week before, a patient came to me for diabetes. I took the case, and really, I do not understand the case well. But one thing I understood, that, see, he is having some mortifications. He came to me for diabetes and for the treatment of diabetes, and I found out that he is having some deep mortification is there. So, for as a research mind, I gave him staphysagria. Staphysagria 10 I gave 1 dose and sent him back. See, yesterday he came. He told me, doctor, my diabetes is completely disappeared. I really wondered. That is the importance of concomitants. I am not prescribed for diabetes, but I only prescribed for mortification. So, a patient having some concomitants, prominent concomitants, if we prescribe for that, actual for that, which disease he came to us may completely disappear. That is the importance of concomitants. Sensation, location, modality is also very, very important.
So I think it's a cause. Most important in acute disease, the most important exciting cause there. That is you prescribe this staphysagria, I think.
Maybe.
Definitely. Aphorism 5 is the most important aphorism. As well.
See, another thing is,
Yes,
a rare, peculiar, uncommon symptom may come as the totality. That is also very, very important. The patient may tell us some rare and peculiar and uncommon symptom. They will narrate to us. And if we prescribe that with that symptom, the actual disease may disappear. In my experience, this also, I have seen a lot of patients.
So it is up to us to sensitize about all these things. That is why Hanuman advises you prove. The physician is the best prover. Why he said so? Because we study, we can study how to observe what are the changes that are happening during this drug proving. We only know the technical knowledge or the academic knowledge, but we don't have enough knowledge on proving reality. So if you prove the medicine, it will definitely will aware of all these things. Harina sir, what is your opinion?
That is correct. That is correct. Very, very correct.
No, this is a question.
See,
Sir, please.
one boy about 14 years of old. He's a very, very sharp, intelligent, regularly going to school and very competitive. Everything is normal, but he is suffering by this migraine. Only 14 years of old. I took the case and I only prescribed him for his ambitiousness. Only prescribed. I gave Naxomica 10 dose and sent him back. 1 week before, his mother reported me that he is having severe diarrhea. I told her, don't disturb, let it be like that. And that migraine is disappeared, completely disappeared. And he is very happy. He says, I am okay, mother. I am okay. I have no headache or anything else. Gradually, that diarrhea disappeared. And the patient got relief and cured.
Yes.
That is homeopathy. I prescribe only his ambitiousness. So
I think it may be an old symptom, maybe.
maybe. That may be an old symptom.
Yes. So that's the relevance of this homeopathy philosophy. Without this, often we heard it is only theoretical on not practical, but it's 100% practical.
Right.
Without grammar, we can't talk. Even though we are not at all happy to study this grammar, but we should use it, knowingly or unknowingly. Without that, we can't communicate. Just like that, knowingly or unknowingly, each and every practitioner of homeopathy is really indebted to this organ of medicine, and they are practicing it, following that often. But it's
Correct.
a problem is that it is written by this master, so we can't reach him. We can't. So it is to understand Hanuman is very difficult because his brain, there is that much depth he has given. Sir, Harold sir.
Very, very correct. Hanuman, he is not an ordinary man.
Yes.
He's in my words, he is an avatar.
No doubt at all.
Avatar. He came here with so many brilliant doctors, and that doctor supported him, and they did a lot of wonderful work. Boger, Boningason, Kent, a lot of fellows. Now it is not seeing like that personalities. We are not seeing such personalities. Only 1 or 2. So
it only happens, sir. That's a fact.
only happened.
There's a question log internal. Dr. H.A. Robert has used the word axillary symptoms. Does it mean as concomitant symptom? Dr. IQBAL, what is your opinion? Axillary
Yes.
symptoms.
Yes.
So as time progresses, we know that different types of explanations are coming. You
He
just
rightly said.
about this.
I also mentioned about
Yeah.
H.A. Robert, what he said.
Yeah.
It's auxiliary means giving extra help. Like
Pardon? Giving?
meaning of auxiliary and concomitant is like giving us like hand, secondary hand, right? So concomitant did do that only.
Okay. Then again, there's a difference of this expression. I think Hanuman mentioned is general symptom in place of common symptoms. Well, it was used by Kent as this individual symptoms is general symptom. So there is a big difference between all these things. So a comprehensive reading and discussion is needed to understand homeopathy.
So aphorism 153, that's very important for us.
Yes.
Yeah, if we say organ of medicine, in aphorism 153, they mention everything. And we must not miss the aphorism number 25 and 6.
And you can see always it's a case of disease. That is the most
Yeah.
important thing.
Yes,
Not disease, but case of disease. So
Right.
it's a big difference between disease and case of disease. That is the crux of homeopathy thing. Dr. Ram Parvesh, after a cup of tea, what is your opinion? Disease and case of disease.
Yes.
They are watching everything, sir. Okay. What is your comment on that?
Oh, case of disease.
Disease and case of disease. How you differentiate between these two?
Disease and case and disease. Huh? Symptom, totality of symptom
Yeah.
according to case of disease, many symptom produce, many symptom collection after disease, kinds of disease. Case of disease according to no.
Yes, sir. Yes, audible, please. You can hear you, sir, please.
Case of disease.
Yeah.
Homeopathic angle of treatment according to symptomological angle treatment and pathological angle treatment, a case of disease. Miasmatical angle of treatment.
Sir, I think there is a more clarity is needed there, sir. Because
According to homeopathic, case and disease, miasmatical angle, sora, psychotic and syphilitic
okay.
is called disease.
Sir, I think it is better to explain or express homeopathy as individual symptomatic treatment, not symptomatic treatment.
Oh, individual.
You know that the allopaths are also using symptomatic treatment for fever. The fever is a symptom, they give paracetamol. It is symptomatic, but it is not homeopathy. It is the individual symptoms. Harihara sir, what is your opinion, sir?
Okay, see, they are giving paracetamol only for the only for the single symptoms. That only that fever, the temperature, they are using the paracetamol. What if that sometimes it may be an exacerbation of a deeper disease. See, if they administer the paracetamol, surely that will do harm for that patient, because the underneath pathology, they don't know what is going inside the patient. A turmoil may be there. But in homeopathy, it is not like that. If we administer homeopathic medicine, it will go to the deep layer and cure the disease, that cure the temperature, and the patient will be very happy, and he may be very energetic next day. That is homeopathy.
Yes, that is why Dr. Herring mentioned the characteristics of cure. I think there are 5 points are mentioned in the life of Herring. That is very important. The convalescence period will be happy, or patient will be healthy without much suffering or weakness is there. Then even though the The exciting cause is again operating. It will not produce a disease. I think 5 points are there. I'm not exactly remembering all these things. So the comprehensive reading is the last resort or the lone solution to become an average homeopathist. I never
Well,
say
not
this.
see,
sir.
not reading only, but the doctor must assess the situation, assess the symptoms, and he must take a decision at his own by his intelligence
To discriminate, that's the most important
to
thing.
discriminate.
Differentiate and
That is
discriminate is the most important thing. What
important
is
thing.
needed, what is not. We should be taken, we should be excluded. Then how to give, what to give, when to give. All these things, not only the medicine potency, dose, and attenuation. These 4
Everything.
points are the 4 legs.
Everything is very important.
Yes.
Everything is very important.
A totality, not in the prescription, but also in the practice of medicine also total is needed. I think. Anybody would like to participate? You can raise your hand. 1 or 2 minutes remaining.
As I can see in this
Yes.
aphorism number 153 footnote,
Yeah.
Animal Sir has said like one Bonnie Hawson, what he has written characteristic symptom of homeopathic medicine and his repertory. He did a great job as per Hahnemann and also J.H. Jha in his handbook of principal symptoms. His mention is in his aphorism, organ of medicine. So we must not neglect him.
Definitely. So I think
He acknowledged.
you young people must read all these lesser writings. The Bonius and lesser writings, Variant and lesser writings, Ken's lesser writings, as well as Hahnemann's lesser writings. Without this comprehensive reading, we cannot claim as Melvin Hahnemann, we never deserve the honorable title of a genuine homeopathist. The honorable title of a genuine homeopathist. That is a word used by our master. So I think it's time to wind up the session. May I invite our Hariharan sir to express a lot of thanks. Sir, please.
Okay, okay. Thank you, Manoj. Thank you, Dr. Manoj. See, really, I am myself and our IFPH office bearers really thankful to you, Dr. IQBAL. So you submitted a wonderful subject, and we discussed in that, and we got a lot of information from that. Okay, really, you come to another session with another subject. See, thank you very much. Good night.
Okay, thank you, sir. Thank you, everybody.
Yes, as mentioned by Hariharan sir, it forced us to think. The thinking is the most important component for the development of homeopathy. Physician, with the remark, let me conclude today's edition. Hope that we'll be back again tomorrow. Till then, goodbye. And Dr. Shaila to continue the program in Malayalam.